Good morning, everybody. Can I thank the 45,000 people throughout our state who were tested in the last 24 hours, and please stress moving forward how important it is for us to get those high rates of testing. We're grateful for that. Dr. Chant had said she wants to see at least the 40,000 number figure continue, and obviously higher rates in those communities we're outlining today are also extremely essential. Overnight, New South Wales had 27 cases of community transmission. Unfortunately, only 13 of those were already in isolation. 7 were in isolation for part of their infectious period, and 7, we understand, were in isolation for all of their infectious period. Now, they're the numbers we're looking at when it comes to determining the length of the lockdown, and that's why the New South Wales government, based on the health advice, which is our key indicator, made the difficult decision to announce the extension of the lockdown and the existing restrictions in the regions for 1 week further until Friday midnight, the 16th of July. Now, the reason for this is, as we've been saying, this Delta strain is a game changer. It's extremely transmissible and more contagious than any other form of the virus that we've seen. The reason why the New South Wales government has taken this position is because we don't want to be in a situation where we are constantly having to move between lockdown, no lockdown, lockdown, no lockdown. What we want to do is give us our best chance of making sure this is the only lockdown we have until the vast majority of our citizens are vaccinated. We know the vaccine is the key to our freedom. The vaccine is key to saving lives and keeping the economy open. We appreciate and understand the stress this means for individuals, for families, and of course for businesses. But what would be far worse is being in a situation where you have to live in and out of lockdown until that period of time when we have the vaccine available to us. That is not a way to live, and we want to give our citizens the best chance of staying safe and healthy, but also making sure our businesses survive and thrive moving forward until that vaccination period is upon us. And that is the context why we made this decision. Every time we make a decision in the pandemic, it's twofold. It's, yes, to keep our citizens safe and healthy, but it's also to give our businesses the best opportunities moving forward. And we know what businesses need is certainty, and what they don't want is a prospect or a future where we're constantly moving in and out of lockdown. And that is the context for the difficult decision we made. Now, in relation to schools, obviously schools outside of the Greater Sydney region, schools in the regions will resume face-to-face learning from next week, which is a great result, and we're really pleased that there hasn't been any instances of the virus in regional New South Wales. I want to thank our regional communities for their patience. We have had a few false alarms or a few close calls in the regions, but the community has responded by coming out and getting tested, by isolating, and also, can I say to regional communities, thank you for alerting police and Crime Stoppers when people from Greater Sydney have been coming into your community. You have defended your communities, and we're really grateful to you for that. In relation to Greater Sydney, the reason why we took the decision around schools not resuming face-to-face learning next week is not because schools aren't a safe place. They are a safe place. But what we really need to do in Greater Sydney is reduce mobility. We need to stop literally hundreds of thousands of adults moving around and interacting with each other inadvertently as they drop kids off, pick kids up at those usual times. And whilst the virus is more contagious in children, or this strain is, than we've seen previous strains, our main concern is too many people being mobile at the same time and having those interactions. So it's really, really important for people to reduce their mobility. In relation to online learning, I wanted to make the following points. Of course, those parents who are doing essential work, who have no option, children are welcome on the school grounds. So as we did last time, the children of essential workers, children who have no other option, or parents who have no option, of course, children will be welcome onto the school grounds. That's what we did last time. And the Education Department and Health have also been speaking to reduce any stress or issues related to Year 12 students. If Year 12 students have practical examinations or need to be on campus for those rare occasions when that face-to-face is essential, the Department and Health are working together on those issues. So we don't want any parents, or I should say students, but also parents, to feel any level of of angst that their child will be prevented, especially in relation to practical type exams associated with trials in certain subjects. But we trust our school communities and health to continue to work closely together. They have for a long time. And we anticipate that to going forward. And when you think about it, I know how difficult it is. I hear from friends and family, homeschooling, home learning is difficult, but it's for 4 days. And let's all pull together and do our best during those 4 days. And I appreciate how hard it is. All of us have different circumstances. Everybody is touched by this. Everybody doing the right thing is suffering. And please know that we get that, completely get that. Everybody's circumstances are different. And no matter what your circumstances, we know this has been a difficult period. But we'd much rather go through this difficult period now to try and stamp out as much of the virus as we can, so that when we exit from the lockdown, we have the best chance of not having to go into a lockdown again. And that is the aim. The measure of success will be preventing lockdowns between the time we exit this one and when the vaccine's available, or the vaccine's been made available to the vast majority of our citizens. Now, I can foreshadow overnight that we've had a number of cases, more than we would like to have seen. And so I'm anticipating that tomorrow's number will be higher than what we've seen today. But they are, at the moment, concentrated in 3 local government areas. Now, Dr. Chant will go through those suburbs in specific order. But I want to assure the community that this morning the Health Minister, myself and Dr. Chant and our teams have already been in touch with community leaders to support us in this. It's really going to be a team effort to ask our community leaders in the 3 local government areas of Fairfield, Canterbury, Bankstown and Liverpool. We've seen the main cases move from the southeast. Pretty much all of the cases we're seeing from southeastern Sydney are now in isolation. So we're pretty confident the virus isn't spreading in that community. But we have seen overnight some concerning statistics on what is happening in the Fairfield, Canterbury, Bankstown and Liverpool council areas. And can I please say to the communities in those areas, many of them have a similar background to me, please don't mingle with family. I mean, I haven't seen my parents since the lockdown started. It's hard. But can I just say to everybody, please don't mingle with family. Don't think it's okay to go and visit your cousins. Don't think it's okay to have sleepovers. Please, in those 3 local government areas, limit your movement. I mean, the New South Wales government doesn't want to go to the next stage, but we are even considering if there are any further actions we need to take in those 3 local government areas. So can I just stress, please know that you might think you're doing the right thing by visiting loved ones. You might think you're doing the right thing by babysitting others' children or whatever. But the key message in the Fairfield, Canterbury, Bankstown and Liverpool local government areas is do not leave the house. Please do not leave the house. I'm pretty certain that most of us have stocked up on groceries for the next month or so. We've probably all got more things than we need. Please avoid leaving the house, avoid going to indoor areas, avoid any activity unless it's absolutely necessary, especially in those 3 local government areas. What is spreading the virus is any form of mobility. And so in particular in those 3 local government areas, we just need everybody to please follow the health orders. Don't think it's okay. I mean, again, Dr. Chant and I can recount the number of examples where people are feeling enormous guilt because they've gone home and given the virus to their children, to their partner and to other extended members of the family if they live in the one household. And that's the last thing any of us want, the guilt of having passed on the virus to those closest to us, but that's what's happening. Most of the cases overnight are people spreading the virus in their own households, in their own families, and in their own friend circle. And when people do the wrong thing, it does have consequences when you have a virus this contagious. But I just wanted to thank the citizens of New South Wales, the vast majority of whom have done the right thing. But more importantly, can I thank those who are already in lockdown communities, and I appreciate for communities like the Central Coast or Shell Harbour or Wollongong who may not have had a number of cases in the last little while, that they will be particularly frustrated that they have to do another week. But this is really to prevent mobility. We know that for essential items or essential work, people are still moving, and it's really easy to transfer the virus from one community to another. And we would much rather all of us do the hard work now to give us the best chance of having a normal life between when we exit the lockdown and when we get the vaccine accessible to our population. I do also want to foreshadow the New South Wales Government in the next few days will be putting forward a specific plan that shows what life will look like the day that we exit the lockdown, and also what life looks like a few weeks after that time. So we want to provide certainty to businesses. We know businesses have to plan ahead when they're taking bookings, when they're ordering, perishable items. We also know that families have to make plans for where they're doing in the next little while. But I can say that face-to-face learning will resume for everybody on the Monday, the 19th of July. And as I said, the reason why it didn't resume in Greater Sydney in the next week is not because schools aren't safe. Schools are very safe, but especially with restrictions that health and education have already been working on. But what is the challenge for us is just reducing mobility, reducing people getting out of the house and unintentionally mingling or talking to each other, thinking it's safe to do so. With this strain, we've also seen a number of people spread the virus without symptoms, and that's scary. So that's why it's so important. Every time you leave the house, please assume that you have the virus or a loved one around you has the virus. Please don't assume that you don't have it, and don't assume the person you're exercising with or the person you're having to work with doesn't have the virus. And whilst the mask is a protection, it's only one of the lines of defence. Wearing a mask doesn't mean you're going to prevent the virus spreading, but it reduces the chances. Everything we do reduces the chances. So please don't assume because you're wearing a mask that you can't spread it to somebody else. Please don't assume because you've hand sanitised or socially distanced. You have to do all of those things to make sure the virus doesn't spread, especially this contagious strain. Now, I'll ask Dr. Chant now to give her health update. Then Deputy Commissioner Worboy will talk about compliance, and police will be in particular focusing their compliance efforts on those 3 local government areas. And I do want to thank the community leaders that New South Wales Health and the New South Wales Government has already reached out to in those communities to help us really get to people on the ground. It really comes down to people doing the right thing. We know the settings we have in place are the right ones, but what we can't assure is that everybody will do the right thing all of the time, and that's what we're really appealing for our citizens to do. We want to make sure that when we exit the lockdown, we have the best chance of not having to go into lockdown again, and that is the measure of our success. It's making sure we give ourselves the best chance of not going back into lockdown until the vaccine rollout happens, because we know once the majority of our population is vaccinated, people won't need hospitalisation, people won't die in the numbers that could occur if the virus goes uncontrolled in the community. So our strategy is about saving lives, but also saving businesses and jobs and keeping the economy open. And whilst it is painful for all of us, and please know this decision wasn't taken lightly, especially when it comes to businesses and especially when it comes to livelihoods. We appreciate the pain and suffering that many people will go through, but for that extra week, we think it's well worth it if it's going to prevent us from having to go in and out of lockdown, which is what we need to avoid. So I'll now ask Dr. Chant to give her update.
New South Wales recorded 27 locally acquired cases of COVID in the 24 hours to 8 p.m. last night. 18 of the locally acquired cases are linked to a known case or cluster, 11 are close contacts and 7 are household contacts of previously confirmed cases. As the Premier has indicated, unfortunately we still are seeing a number of cases arise where they're infectious in the community for part or all of their infectious period. So only 13 of the cases were in isolation. Of the 27 cases were in isolation throughout their infectious period. 7 cases were in isolation for part of their infectious period, and 7 cases were infectious in the community. There were 45,000 tests, which is pleasing to see that uplift in testing from the 32,000 the day before. We are going to need to have the community continue to come out in droves for testing, and I'm going to highlight particular requests for testing in certain areas when I touch on my overall assessment of where the risk lies. Currently, we have 37 COVID patients admitted to hospital, and of these patients, there are 7 people in ICU, 2 of whom are ventilated. Now, this is in the context where New South Wales Health also provides excellent home assessment and care. So the fact that 37 patients have been admitted to hospital should indicate to the community the fact that COVID, including the Delta strain, is not a mild disease. It can be mild in some, but for many it can lead to hospitalisation and death. 14 of the 37 admitted to hospital, of 14 people admitted to hospital at the moment are under the age of 55. So of that total 37, 14 are under the age of 55, which should dispel the myth that this is only something that impacts on the elderly. And of those, 8 are under the age of 35, again dispelling that myth that it only leads to hospitalisation for the elderly. Of the 7 people in ICU, 1 is in their 30s. A bit of a wake-up call to young people. 1 in their 50s, 2 in their 60s and 3 in their 70s. I want to call out some venues of concern. The Commonwealth Bank at Roselands. So we've had 2 cases to 8 p.m. last night linked to that Commonwealth Bank in Roselands. So again, reiterating, if you were a customer at the Commonwealth Bank at Roselands at the following times, Monday the 28th of June, 8 a.m. to 5 p.m, hopefully we've already reached out to you, but if you haven't received that advice and you were there during that hours, you are a close contact. And similarly on Tuesday the 29th of June from 8 a.m. to 5 p.m, and Wednesday the 30th June from 8 a.m. to 3:30 p.m. In terms of my overall assessment of where we're going with the response, we are seeing cases still occur in areas outside southwestern Sydney, in southeastern Sydney for instance, but those cases are tending to occur in household members and close contacts of known cases that have been in isolation for their full infectious period. In relation to Wollongong and Shoalhaven, again, we are redoubling back on all our cases to make sure our controls were in place, but again, the cases that have arisen there have been in close contacts and household contacts. In Western Sydney and Sydney, we are still watchful that there are no more cases in the community. We have been responding to some construction site clusters and tracking down a large number of construction workers who work across the Greater Sydney. But what our focus has really turned to is southwestern Sydney. In southwestern Sydney, we have seen a number of cases across multiple households. Now, on the good news, many of those households are linked. And the message is getting out, and can I thank those individuals for their cooperation. Again, to reiterate that health will maintain the privacy, and if anyone has erred in terms of met up with someone, we would much rather you tell us. What we are really concerned about at the moment is preventing any further chains of transmission containing these clusters across these multiple households, with some links extending beyond those households. The concern we've got, though, which is reflected in the numbers of the people that are infectious in the community, is the fact that by the time we get to those household cases, the rest of their household is already infected and so therefore has been unknowingly in the community infectious. We are doing that contact tracing, so when we have a case, we ask everyone in the household and their other contacts to be isolated. But what we've already found, even with that strategy, we are still having people infectious in the community. So the areas that we're particularly concerned about: Bosley Park, Smithfield, Fairfield, West Hoxton, Bass Hill, St John's Park, Canley Vale, Greenfield Park and St John's Park. So that area of the Fairfield local government area, with obviously some overlap and egress into Liverpool and Canterbury Bankstown local government areas. As I said, I want to thank those community members for their cooperation. Please continue to work with our contact tracers in providing that advice about your movements. But in those communities, we are asking you to just redouble your efforts. Please stay at home. So if you're in those local government areas of Fairfield, Liverpool and Canterbury Bankstown, please stay at home. Do not visit loved ones. Try and engage through digital means. Try and avoid any unnecessary contact with other additional households, and please limit your movements into any indoor environment. So only have one person go and get the shopping. As the Premier has indicated, if you have got enough food, don't leave the house at this time. And this will allow our contact tracers to identify people that may have been exposed so that we can reduce the number of unknown people in the community. And then the other message is, if you actually do have to move about in those locations, please do not assume someone is unknowingly infectious standing next to you. So keep your distance, make sure you're wearing those masks, and again, I would urge you yourself to minimise your movements in that community. Clearly, the objective of our response and the basis of the health advice is that with the transmissibility of the Delta strain, we want to approach any removal from the lockdown of having given it the best shot at removing any chance of community transmission. We believe that that is the best setting so that we're not having to be thrown in and out of lockdowns. So this is really a crunch time for the community, where the destiny is in your hands, and we've done it before. And the communities of southwestern Sydney are a vibrant, connected community, and you've tackled previous outbreaks and done so well. I'm asking you this time to even redouble those efforts and work with us to get this under control. But I also don't want the rest of the community of Greater Metropolitan Sydney to take their eye off the ball. Anyone else in the broader area, please continue to come forward and get testing. Look at those venues of concern. Please follow the public health advice.
Dr. Chant, Premier, Minister, good morning. 75 infringement notices issued in the last 24 hours. Of concern, 2 of those notices issued to people who were at a barber shop in Liverpool carrying out hair cutting. Clearly, those people no regard for the public health orders and, in fact, the situation that the Premier and the Chief Health Officer have alerted us to today in those 3 local government areas of Fairfield, Liverpool and Bankstown. It is quite clear that police, based on that health advice, need to redouble down their efforts again in those local government areas. That's happening right now. We would much prefer that people comply with the public health orders, they make sensible and good decisions, rather than have people call Crime Stoppers or the local police station and ask police to go along, like the barber shop, and intervene and have to write out infringement notices for breaches of the public health order. It is quite clear that we are still going to move through a week or more of the public health orders, of the police response right across New South Wales. Our police are well up to this. They are well briefed. And in particular, from here on, where the issues are of concern, we will make sure that we move additional police to those areas, provide a highly visible police response, and we simply ask that people comply with the public health orders. They do this to look after their own health, the health of their family, and indeed the community. Thank you.
You said that the Delta strain is a game changer. Why didn't you go harder earlier, lock down Greater Sydney quicker, so we wouldn't find ourselves in now a 3-week lockdown predicament?
Well, look, I'm happy for commentators to say what they wish, but what the New South Wales government does is rely on the health advice. We receive advice on an hourly, on a daily basis, and we need to respond quickly when we get advice which causes us to ask the community to do major things, major disruptions in their lives, such as a lockdown. We always base our decisions on health advice. The health advice gives us information at a point in time, and it's important to note that the cases we're seeing today is a reflection of what may have happened around a week ago or 5 or 6 days ago, and that's why it's really important for all of us to stick together and do the right thing. Our job is to make sure the people of New South Wales, and especially those in those lockdown communities, understand the importance of us not moving around unless we absolutely have to. And again, a call out to the local government areas of Fairfield, of Canterbury Bankstown and Liverpool. The cases coming out, especially for those infectious in the community, are from those 3 local government areas. So please do your part. All of us can play our part. Every single one of us has a role to play in keeping our loved ones safe, but also keeping New South Wales strong. And this is our big chance, our one chance to prevent us from having to go into lockdown at a future date, because we know how contagious this Delta strain is. And the last thing we want to see is New South Wales moving in and out of lockdown. Sorry, James first, yep.
You go through certainty, Premier, saying that face-to-face meeting will review everybody from Monday the 19th. Can you give certainty for everyone else in the community that the lockdown will lift at the end of Friday the 16th? And if not, what metrics do we need to meet so that the lockdown will lift at the end of next Friday?
Certainly. Well, what I will be pleased to do on behalf of the government, and of course colleagues and experts are working on this, is to provide in the next few days a roadmap, if you like, a plan for what exiting the lockdown looks like. And that could be a period of 2 weeks post the lockdown, and then what life looks like after those 2 weeks as well.
Will it end next Friday?
That is absolutely our intention, and that's why we've provided that certainty, and that's why we've said this is our one chance to get as much of the disease out of New South Wales as we can, and that's why it's so important for all of us to do the right thing in the next 9 days. It is so important for all of us to stick together. We've done it before. We've beaten the odds before, and this is perhaps the biggest challenge our state faces since the beginning of the pandemic. But I also want to make this point. The government understands and appreciates that many in the community, notwithstanding the frontline public servants, notwithstanding workers and families and businesses, people are tired and fatigued after 18 months. So whatever decisions we take, we have to make sure bring the community with us every step of the way. And as Dr. Chant said so eloquently, it's up to all of us. What happens in the next 10 days and beyond in terms of how we tackle the existing virus is up to all of us. It's our actions. If everybody stuck to the rules, if everybody did what we asked, we know what the outcome will be. But unfortunately, we can't predict that every single individual will do the right thing all the time. Our police will be out in force, our regulators will be out in force, but we also have to take personal responsibility. And that's what has really stood us in good stead over the last 17 or 18 months.
But every single person here will be getting a wage, regardless of lockdown or not. Now, the platitudes around business are fine, but that's what they see it as, platitudes. The most you're offering business so far in New South Wales is $10,000 cash, and you're mandating that they shut. Should you be doing more?
Well, look, there's always opportunities for us to consider what more we can do, and I can confirm our State Treasurer, Don Perrottet, has been in touch with his counterpart at a federal level. So we're considering all those options, but I please say I know and appreciate how difficult it is. The New South Wales government has already contributed billions towards our economy over and above what we anticipated to support everybody during COVID, whether it's various measures, direct grants or other measures we've undertaken.
Right now, Premier, ultimately business, there's some that won't come back after these 3 weeks.
Well,
and there are employees right now who aren't earning a wage, and the best you're doing is $10,000 cash. That's nowhere near enough.
Well, I'm sorry, in terms of individuals, the Commonwealth is offering
$350.
Right, and
that doesn't pay rent.
No, but that's why our Treasurer has been in touch with his federal counterpart to have a conversation about those matters. What National Cabinet determined, which all the states are beholden to, is that the Commonwealth would be supporting individuals during lockdowns and that the states would be supporting business during lockdowns. That is what the decision of National Cabinet was. And New South Wales has obviously already announced a package. If we need to do more, we will. But I also say this, I know how tough businesses are doing, but I also appreciate they would much prefer living in an environment where there wasn't a lockdown every second week as opposed to what we're doing now. So the message to businesses is we know the business community would prefer to live in a certain environment without having to go into lockdown every few weeks, and we are giving our community the best chance of not having another another lockdown until the community is vaccinated. And I think the consultations with the business community have been deeply appreciated. My colleagues have been in touch with many business leaders, many peak bodies, and we appreciate, and that's why a lot of the decisions we've taken have in mind not just individuals and families, which of course safety is our number one issue, but also what it means for businesses. And businesses would much prefer a certain operating environment, which is what we'll be providing, rather than have us going in and out of lockdown.
Nobody should be worried about their financial circumstances. We're hearing stories about business owners who are contemplating suicide.
Well, look, I appreciate more than most, having lived with this every day, the pressures it puts on people, even speaking to people who've had to do 14 days in isolation. Mental health for many of our citizens is a big issue at the moment, especially for businesses who are trying to stay afloat. And if we need to do more, of course we will. But please.
We do need to do more because this is their livelihoods on the line, and they're saying that they need an answer now about extra support.
Look, we deeply appreciate that. But can I say the New South Wales government, based on health advice, took this decision yesterday about extending it for a week. Can I say?
You could have told parents and the rest of the state about this last night. Why did you sit on this information for 15, perhaps more hours?
Yesterday, I was very upfront to say we would tell the community today at 11 o'clock. I don't know.
You made the decision yesterday. Parents would have appreciated more time to make plans for next week.
Can I say I'm a person of my word? Yesterday at 11 o'clock, I said to the community I would let them know today at 11 o'clock what the future would look like, and that's what I've done. Sorry, someone who hasn't answered. Sorry, we'll get round to everybody. Just one at a time.
Some clarity on the health advice when it comes to delaying the resumption of schools in classrooms, because there is a bit of confusion with businesses in particular about what the definition of essential work is. Can you send your children to school if you have no other option? Do you have to be deemed an essential worker? I mean, if you have a small business and you need to do that, can you do it?
We went through this the last time New South Wales had a lockdown, and no school turned any child away. But we also appreciate that parents have to make some serious decisions. Our strong preference is that parents keep children at home for homeschooling for the 4 days. But if they have no other option, the child is welcome on the school playground. That is what we had decided, or what we did last time round, and it worked well. The school communities are aware of what needs to occur. Parents in the main are aware of what needs to occur, and it's important.
Sydney as a whole, you named these 3 LGAs that are of particular concern. Do you really need to stop kids from going to schools across the rest of Greater Sydney?
Look, the New South Wales government considered those options, but as we know, some essential workers, whether you're driving a truck getting food and services to large supermarkets, people move outside of where they live to provide essential work. Cleaners move outside where they live to provide essential work. People providing takeaway services move outside where they work. And it's very complicated. The difference between what we're going through now in the Northern Beaches is twofold. Firstly, this variant of the virus is far more contagious. And during the Northern Beaches cluster, we had a clear geographic delineation we were able to make. We can't make that in this situation. And that's why we came to the conclusion we did. And again, it's not because schools aren't safe. Schools are very safe environments, especially when health and education have worked together so well in relation to restrictions to keep everybody safe. But what isn't safe at the moment is literally hundreds of thousands of people moving around at the same time during drop-off and pick-up. And that mobility issue is what was concerning health. And please know, discussions went on for hours and hours as to what is the best way forward. And this is by far the best way forward for our community. Who hasn't asked a question? Can I please just ask people who haven't asked a question before, and then we'll get to the second ones? Yeah.
In regards to the 3 LGAs, can you clarify the next step that you mentioned? What would a next step be?
Look, health will consider that advice, but a next step could be limiting even further movement through the health orders. At the moment, obviously, we have broad rules as to why people are allowed to leave the house and allowed to exercise. But if we need to, health may provide advice on further restriction of movement in those communities, but that's yet to be determined. I only foreshadow that to highlight how concerned health is and how concerned we are about those 3 geographic locations and the way the virus is spreading. Clearly, Clearly, there is a transfer between linked households, so people are visiting other households when that's not what that should do. But can I stress this? No one is going to get into trouble. We would much prefer people came forward and tell us everything they know. And so that is our first rule of law always, is to make sure that we provide a safe way for people to tell us the truth, because then we can, excuse me. No, I know it is, but can I just finish my sentence? So it's really important for all of us to make sure that people know they can't move around households, they can't move around the community. I will ask people who haven't asked a question before. Yeah.
Victoria went harder earlier. They had limits on 5 kilometre limits from their home. Their retail certainly wasn't open. We do have big, Westfield Bondi, for instance, has stores in it that are open, that, you know, lingerie stores, Louis Vuitton stores are open. Is that not creating confusion as to what people should be doing in the first place? And has that meant that we've had to extend this lockdown?
No, the reason why we've extended the lockdown is because of the number of cases still infectious in the community, and we extended the lockdown to give us the best chance of not having another lockdown. But it's very difficult to define, because a lot of the people who have got the virus since the lockdown began have been twofold. Firstly, literally essential workers going to work with symptoms, or else household members mingling with people they shouldn't be mingling with and spreading the virus. So what we do know is two things. If you have the mildest of symptoms, stay home. Don't go to work. Don't leave the house unless you need to get tested, and then stay home. Second of all, do the right thing. Now, it doesn't matter what rules you put in place. We do rely on people doing the right thing. And we've seen, again, it's a fine line, because we don't want to prevent people from coming forward and telling us the truth. We need people to tell us where they've been and what they've been doing.
So then why drag the Deputy Commissioner and the Commissioner to the press conference every single day wagging the finger at 5 million Sydney-siders? What do you expect them to do?
Well, what we have relied on to police from day one is supporting the government's decision in relation to compliance. And Deputy Commissioner Worboy, on behalf of the New South Wales Police Force, and Commissioner Fuller, on behalf of the people of this state, have made sure that if there are examples of people not doing the right thing, that they're held to account. And today, when we know now where the concentration of cases are coming from, the police force will be able to target those areas.
That's not counterproductive, that's what I'm asking. If you want to fight cases using
Sorry, I don't understand the question.
Well, if it's highly visible enforcement in one area, wouldn't that then put people into their shells rather than tell New South Wales Health the truth?
No, because the way New South Wales Health communicates with people is extensive interviews, making sure people tell us the truth. But I think people also appreciate you need the right balance. You need police there preventing people from doing the wrong thing and punishing people for doing the wrong thing as an example to others. But at the same time, we don't have 2 million police officers standing at the corner of every street, and that's why we do rely on people to do the right thing. No police force on the planet has the ability to monitor every single citizen. But we know the vast majority of our citizens do the right thing, but when it's a handful of citizens don't do the right thing, it jeopardises and compromises everybody. Have you asked a question yet? Yeah.
Can you explain the continued restrictions and mask wearings across the entire state? Can the regions blame the Sydney-siders who broke the rules and ignored the travel bans, or is there a large number of essential workers still entering the regions? Yeah, no, the reason we've continued the existing restrictions across the state, including those in regional areas, is to protect and prevent the virus from coming into those communities. We had a few close calls. Remember, there was a few miners that were involved in the mine that was exposed in the Northern Territory and then came back to regional New South Wales. There were some other essential workers who live and work around in regional New South Wales. So whilst the virus at the moment isn't in regional New South Wales, which is a great thing, we need to make sure it stays that way. So, for example, if someone inadvertently is an essential worker who comes back from another state or comes back from an exposed area, whilst that shouldn't occur, we have seen a few instances when it has occurred, and that is just a prevention to make sure we keep the virus out of their regions. And I really want to thank people living in the regions for following the rules
and also being one of our biggest public defenders. They've noticed when people who don't live in their town have suddenly turned up with a carload of tourists. So I really want to thank Regional New South Wales for helping us in publicly defending our communities from the virus. It's working. And it's just an extra measure of safety and confidence to make sure that we prevent the virus penetrating any of our regional communities.
Would you consider the area-specific lockdown for those 3 LGAs like
Well, I just want to foreshadow that we have had very initial, and I've got to obviously consult with relevant experts and colleagues during the day. But there is an option for the government to consider based on the health advice, and I might just ask Dr. Chant to say a few words about that.
So at the moment, we're just mentioning very clearly to the community that there is that risk that is escalating in that area of southwestern Sydney. As I said, the Fairfield, Canterbury, Bankstown and Liverpool local government areas. We know that at the moment it does appear to be predominantly across social groups or connected households, but that some of those connections are loose, and what we need to do is work on establishing the degree of those connections and then do a ring of testing around those individuals to make sure that there's been no further escape into the broader community transmission. Now, because of that, we really do not want people to be moving about. We want to reduce mobility in and out of those local government areas, and we would prefer that people basically stay at home if at all possible, minimise your movements. So clearly we can achieve these outcomes in many ways, and I think it's really important that we understand that there are the public health orders, but ultimately it is about explaining it to the community about the importance of their actions. And we need everyone to help us communicate. I don't think any young person in southwestern Sydney wants to be the cause of an illness or death in their elderly grandparents. I don't think anyone wants to knowingly spread. I don't think that's the starting point. I just think sometimes as we go about, we haven't communicated effectively the level of risk and what we're asking the community to do. And everyone's got a role in doing that. So we have reached out to the mayors, and I'd like to thank the local governments who have been amplifying the health messages, the religious leaders that have also reached out to their communities, professional leaders in the communities. This is a shared responsibility, and yes, there can be the orders, but as we know, it's more about what people do. The risky settings are households. We're asking people not to mix across any households, even for care, compassion. Let's just please, no mixing, particularly in those LGAs. I just did see the previous question about retail, and look, it is pleasing to see that the exposure sites we're identifying in the main where people have been out and about are actually things like shopping centres, banks, Service New South Wales. So that again gives me comfort that the community is in the main making those wise decisions, that what we're asking the community to do is to actually just limit their shopping to the essentials. Make it a quick visit, in and out. Shop online. Please get, delivery. These are the methods that we'd like you to be using over the next 10 days of the lockdown. If we work together, we can get on top of this. And as I said, the best outcome for everyone is that we achieve no community transmission of this Delta variant.
Dr. Chant, is the Southwest thought to be linked to the West Hoxton birthday party?
No. So this is why this disease is so hard, because you're always looking backwards. And what is clear is that there's a chain of transmission, I think I'd indicated to before, and why we actually advised government about the need for lockdown, is when there was a chain of transmission which was uncovered, which then indicated that the transmission chain had deep roots in it and had been extending into southwestern and western Sydney. So look, we're still doing the mapping of all of those linked cases, but it doesn't link to the West Hoxton Park birthday party. There are other links to other clusters.
Dr. Chant, had you called a lockdown earlier, how big of a difference would it have made had that happened 2.5 weeks ago? Would it have changed the course of the 3-week lockdown now?
Look, my honest impression is probably not. clearly the issue is that this had established a number of workplace clusters, which then provided seeding. So those workplace clusters would have seeded because essential work would have still continued. So because of some of those transmission chains were not recognised at the time, despite a good, reasonable response to the community, it had meant that there were these chains that had established in workplaces which would have then resulted in what we're here. So I think the key message is short lockdowns work when there isn't any established chains of transmission and you've got that comprehensive. Prolonged lockdowns and community response is required to really achieve the outcome that we've got today. And I certainly understand the incredible impact on the community, and that's why I'm sort of asking everyone to just redouble their efforts over this 10 days. Give it our all.
Dr. Chen, what was the error that saw 160 Year 12 students at Joey's get their shots? And can you categorically say that no other private schools have been given a fast track to get their vaccine?
So clearly there was an error, and I can understand the concern and sympathise with the anger in the community about that occurrence because, as we know, I've said repeatedly that the vaccine needs to be administered to those most at risk, and that certainly is the elderly and people in those aged care workers and healthcare workers. That was a misunderstanding, a miscommunication, a misstep. Sydney Local Health District have apologised for that, and certainly it's the only cases we are aware of in that regard. I apologise. I know my colleagues in Sydney Local Health District have expressed that publicly as well in a media statement.
Dr. Chen, just on the people in ICU, do we know how many have been vaccinated yet or had one or both jabs?
Look, we're collating that information and we will let you know, but I mean it's been pleasing. We'll pull this together more formally, but clearly the vaccine's actually vaccination's actually been a great tool. So even some of the cases we're not telling you about, we know that when there's a household case and there's someone that's vaccinated for 2 doses and waiting for a gene expert test in the late hours of the night to know if they've been infected or not, it gives us that little extra comfort that they're not likely to be infected. And certainly we know that both doses of the vaccine are incredibly helpful in preventing hospitalisation and death.
Dr. Chant, we've seen in this outbreak, as far as I'm aware, transmission in a school setting between students, right? Are you at all worried that when face-to-face learning goes back on Monday the 19th, that will occur again and pose greater risk to the community?
So what our task for us ahead in the next 10 days is to identify all those unrecognised chains of transmission and lock it down. That is the first thing we can do to prevent any outbreaks anywhere, in workplaces, in other settings, in critical places. Meanwhile, we've been doing a lot of work with schools, and I just want to acknowledge the work of the Department of Education and the Secretary of Education and the Minister in looking at refreshing our settings for schools in terms of a risk framework for schools. You'll be familiar with some of the strategies, but the first thing we do is keep off, have that kiss and drop sort of routine where we're preventing parents and others onto the school campus. We try and avoid mixing between school classes. We try and move higher risk activities to outdoor environments. So there's some comprehensive documents that we've developed, including mask wearing recommendations that will actually work to create a safe environment in schools.
Would you mind? Supply is at the heart of the issue, as
I'm sorry,
we know.
say that again.
Supply of vaccines remains at the heart of the very issues we're facing at the moment. Pfizer in short supply. Are we seeing a problem here that 3-week timeline between first and second jabs are being blown out because of that supply issue? Have you got any data on that?
Certainly the lack of supply, lack of certainty of supply going forward is causing us massive concern. I think it's safe to say that if we had had the supply that we wanted and we like, or would have wanted, we wouldn't now be in this situation here in New South Wales. The simple fact is that, New South Wales Health have done an incredible job, as have the GPs. They've all wanted to do more. I think tomorrow New South Wales Health will have administered 1 million vaccinations. That's an incredible achievement, and of course we would like, New South Wales Health, New South Wales Government would like more vaccine. But there's been no issue on that, because obviously that's part of the logistics layout. But I think I just want to stress the situation we're in now is largely because we haven't been able to get the vaccine that we need. I'm not reflecting specifically on the federal government there, because I think the federal government faced a very tough ask getting the vaccines from across the world. Every country in the world wants vaccine. And of course we're hearing that some of the vaccines produced in one particular country, and possibly two, aren't really up to the task as well. So we're in a 1 in 100 year pandemic. We've got to accept these challenges are upon us. But I think it emphasises there's so much of this that still remains unknown. But anyway, look, at this stage, all I can say is we're doing our best to try and get as much vaccine as possible, get it into arms as quickly as possible, and until we do, we face these risks. I just want to emphasise too, listening to Dr Chant talking about the issues with the community, particularly in southwest Sydney, but more broadly, governments can only do so much. At the end of the day, it is about community and individual responsibility. People have to actually recognise that this is a very dangerous period in the world, and a very dangerous period here with this challenge of a lack of vaccine. And we need to all take individual responsibility. Listen to the messages from the Chief Health Officer. It's not just Kerry Chant. No, some of you who come to these press conferences, I think it's Dr Chant's just it. No, it's not. It's an entire public health team that are working right across New South Wales. I watch Dr Chant in the morning, from early in the morning till sometimes midnight and 1 o'clock in the morning, taking and making calls to teams right across New South Wales. It's a tough, tough job. And there is no black and white. I know journalists love to think there's a black and white. No, there's not. It's a nuanced answer every time. And they're doing their best and we're doing our best. But we need individuals to be with us on the journey. I love a question from Mr O'Keefe.
Is there a chance that the Delta variant is just too good for us, and the social consequence of lockdown will just be too great and we'll have to just give up?
I think at some stage, if the individuals that we need don't hear Dr Chant's message and don't respond, then at some point we're going to move to a stage where we're going to have to accept that the virus has a life which will continue in the community. But we're trying damned hard at the moment to make sure that we can use every effort to suppress that virus. And right now is a critical time. We've used that expression a number of times, but I can't tell you, as Health Minister, just how critical it is at the moment, particularly for the community in southwest Sydney, Canterbury, Bankstown, Fairfield and Liverpool, to understand that your actions, your individual actions, may well determine the future of this virus in our community. Please listen. Hang on a sec. I love your enthusiasm, but I'm actually just going to listen to one person at a time. James.
Minister Hazzard, how damaging is it for the public's perception of the state government's vaccine rollout that New South Wales Health, your department, accidentally vaccinated about 160 Joey's boys, and how embarrassed are you?
What I find more embarrassing, James, is that you would make that sort of question accusation against frontline health staff who work their butts off and who tomorrow will have achieved $1 million vaccinations into arms. You know what? The school intended it well, there was a mistake, and so what? It's happened. Out of 1 million vaccinations, move on.
Last couple of questions.
You just on another issue, pre-mentioning life after lockdown. So what does that look like? Does that look like accepting more cases in the community?
No.
Does that look like tougher restrictions? What does that look like?
Well, obviously our aim is to clamp out as much of the virus whilst we're in lockdown as we can. The closer we get to 0 cases of community transmission, the better it is for all of us. And that is the strongest message I can send. But clearly, we need to think about life beyond lockdown and provide certainty, which is why the New South Wales Government, after taking advice from health experts, will put out our plan, our exit strategy from the lockdown, to give everybody certainty about the future. And I just want to stress, in the strongest possible terms, the next 9 or 10 days are absolutely critical. Our future is in our own hands. It's not just about following the rules. It's not just about knowing what to do. It's actually not cutting corners. It's making sure everybody does the right thing. All of us are working hard together, and so many in the community have made enormous sacrifices. So many in the community are going through mental difficulty and anguish, understandably so. Understandably so. But I can't stress enough how it's up to all of us to keep ourselves accountable, but also others around us. If you have a family member who's thinking, oh, it's okay to have a friend over, or it's okay to go visit this person, please tell them not to. This is a time when all of us have to come together, all of us have to show what New South Wales is made of, and really demonstrate enormous resilience, as difficult as it is, because the harder we work the next 9 days, the better the future will look for us until the end of the year when those vaccine supplies arrived. And this is really a point in time where the next 9 or 10 days will determine how we live until those vaccines arrive at the end of October. Now, that is... Ask the question.
Clarify something. Just in terms of income support for individuals, is the Treasurer going to go to this federal counterpart and beg for more money? Because we think it's not enough.
Yeah, we've actually in the process of doing that, so I can confirm Treasurer Berejiklian has been in contact with his federal counterpart in relation to supporting individuals and what that means during this time. And obviously it's in the national interest for New South Wales to keep doing what it has done in the last 18 months. New South Wales has really carried the burden in terms of economic activity, in terms of welcoming home Australians. We've done all that hard work, and now if we need extra support, I hope it's there. Last question. Sorry, guys. Sorry. Can I just? Yes. Thank you.
Where do you think the community's at the moment? Because yesterday we heard...
I'm not answering on that one, by the way. Yep.
Minister Hazzard talk about Hunger Games at vaccine centres. At Bondi at the moment, there's a floral shrine for 2 young boys that committed suicide last weekend. And you have people dobbing each other in. Where are we at as a society?
I think we are at our best when we're faced with the most difficult of circumstances. And I had a sense, as did many that are close to New South Wales's daily battle with the pandemic, that we were entering a very scary period of the virus, and that's definitely the case. My sense is that a lot of people are doing it tough, but the vast majority of our citizens appreciate that if we do the hard yards now, it's better for all of us in the next months ahead. And please don't think we haven't thought about what this means for individuals, for people living on their own, for people who don't have a lot of support around them, for parents having to juggle working from home and home learning for a week, for people who are trying to run and keep their small businesses going, for people who need to keep their larger businesses going, and also for people like casual workers who obviously rely on those incomes. So we appreciate how tough our citizens are doing it, but we also appreciate that this pandemic has been catastrophic on its scale globally. It's been catastrophic on its scale economically around the world. Here in New South Wales, to date, we've weathered the storm reasonably well. We are entering a critical period, and I appreciate many people will have an opinion on what the government is or isn't doing and what we should be doing. But I know that we have the best health experts on the planet, and I don't say that lightly or in a biased way. And if we all follow the advice, and this is the point I really want to get across, if we follow the advice, we will all be okay. And the New South Wales government is here to support those who may not feel that they can cope in the next 10 days. Please know that we only made this decision yesterday. We've announced it this morning, and we will now look at opportunities for us to continue to support the community. Thank you very much.